Good afternoon, everyone. And today I'm pleased to be joined by Mayor Pro Tem Dave Martin, Councilmember Cisneros, Councilmember Gallegos, Chief Pena, Dr. Persse, and a few of my directors are round and about. Let me just say that the Houston Health Department reports today 1,544 new cases of COVID-19, bringing Houston's total to 30,965. So we crossed the 30,000 mark today. Sadly, we are adding 8 people to the list of those who have died as a result of COVID-19, which will bring our total count to 277. Of the total 277 people who have died as a result of this virus, 73 are associated with nursing homes and 3 with the Harris County Jail. The Harris County Jail's number has not changed in a couple of months. The 73 has inched up as it relates to our nursing homes. To give a little bit more information about the 8 people who have died, a black female in her 70s, who passed with underlying health conditions, who passed away on July the 4th. A white male in his 80s, again with underlying health conditions, who passed away on June 25th. A Hispanic male in his 50s with no underlying health conditions, who passed away on June the 27th. A Hispanic female in her 90s with underlying health conditions, who passed away on July the 6th. A white male in his 40s with underlying health conditions, who passed away on June 25th. A white male in her 80s with underlying health conditions, passed away June 29th. A Hispanic male in his 40s with underlying health conditions, who passed away on June the 4th. And a black female in her 90s with underlying health conditions, who passed away on July the 9th. COVID-19 is a virus that continues to run rampant in our city. And again, it is a virus that's running rampant that is still out of control. And so what we do today and over the next few weeks is critical to getting this virus back to some degree of control, and a virus that we can manage. And as you can see, the people who are impacted, especially who are dying, or anywhere today from their 40s up to their 90s, and in one case, 40s, with no underlying health conditions. The virus does not discriminate. It is an equal opportunity abuser, and certainly it will impact anyone who operates in close proximity with others. We learned today that the Houston Rockets player, star player, Russell Westbrook, tested positive. So again, it's a reminder, this virus doesn't care who you are, what your social economic status is, whether you have a title, no title at all, it will impact you. And so I want to thank Russell for sharing his message on social media, encouraging people to mask up. And that's one of the few tools that we have in our arsenal, and that's to mask up. And the more people that masked up, the greater our chances are with slowing down the progression of this virus. So let me just say, it's not just enough for half of us to mask up, but we need pretty much a high degree, in the 90s, a degree of people complying and masking up that will help to slow down this particular virus. And getting the virus under control is critical because testing and contact tracing and hospital capacity is strained and is being pushed. So please, we have to do all of these things in concert with one another. And what we do today and over the next few weeks, couple of weeks, quite frankly, remains even more critical. I want the economy to remain open, like all of you. I want people to be able to hold on to their jobs, I want businesses to be open, but it is important that we deal with this virus today. And then as we talk about the opening of school next month, quite frankly, what we do in the month of July will pretty much determine what will take place next month. And so instead of people kind of looking quickly to next month, we need to be singularly focused on slowing down this virus this month. And I mean not only slowing it down, but slowing it down such that the number of people going to our hospitals, the number of people in ICUs, that number should be going down and should be going down and staying down. And that way it would provide a greater degree of comfort when we are talking about sending our kids back to school. It also means that we need to stay home as much as possible. If you can work remotely, then I'm encouraging people to do just that. Avoid gatherings of more than 10 people. Leave the house parties alone. That doesn't work in your best interest. These big splash town pool parties, not real good. I mean, not good, not wise. We need to be avoiding all of those type of things. And so there's a lot that's taking place, but it's so important when we're hearing these numbers, 1,544 new cases today, 8 new deaths, that should send a strong reminder that we still have a lot of work to do in this city. Dr. Persse.
Thank you, Mayor. We've talked previously, we talked about the positivity rate, and so I think we got a couple of graphs that are coming up here, and this monitor is off, but that's okay. But we have, we mentioned about a week ago, the positivity rate was at 25.2%, and these are tests that are done within the city limits of Houston. And what this graph shows is the purple line is the positivity rate, and you can see that it is at a very high level, and it continues to go up. Now, it's only inched up since last week. It's gone from 25.2% to 26.8%, but in June it was, in June, at the end of June it was 25.2%, but in March it was 14.7%. The yellow bar is the number of tests, the red is the number that are positive, and what you can see graphically there is the effect of the lag, but if you notice that the purple positivity rate accounts for that, and so over time, over the next 2 weeks, those bars will probably come up, but I don't expect that the positivity rate will change a great deal. So, as the mayor pointed out, the virus is still very active and spreading throughout the community. If we go to the next slide, we have a map showing the zip codes that have the highest positivity rates. The darker the blue, the higher the positivity rate. Now, a word of caution as we look at this. These are the residences of the folks who tested and were positive. This does not indicate necessarily where they contracted the virus. So remember, we've said that the person you're most likely to infect or be infected by is a family member. The second most likely person you're going to infect or be infected by is a coworker. So this is the reflecting where people live, not necessarily where they work. Also, please don't misunderstand that those zip codes that are more lightly colored are necessarily safe. There is still viral activity even in the lightly colored zip codes. And I would also point out that this map represents May and June, and if we had looked at this in April and May, the map would probably have looked quite different. The virus moves around. This is just a snapshot in time, but I think one thing for people to take away is that we are trying to keep close tabs on it, and you will notice that there are quite a number of zip codes where it's greater than 25%, and ladies and gentlemen, that percentage is just way too high. And as I've said before, and the mayor has said, and others, is that our destiny is in our own hands. You want the economy to open up, wear a mask. If you want the schools to open up, stay 6 feet away from people. If you want everything to get back to normal, don't go to big parties, just follow the rules. It's not that hard, and we have been successful before. We can be successful again.
Thank you, Dr. Persse. Chief Pena.
Thank you, Mayor. So today, the number of firefighters in quarantine is looking a little bit better than we did a few weeks ago, but we're still experiencing a high number of personnel that have been sidelined. We have 190 firefighters today that are in quarantine. We have 2 that are in the hospital. 1 is in ICU. He's being monitored in ICU. He's on a BiPAP. He is not intubated, and we're hoping that he makes positive progress and hope to see him out of ICU here pretty soon. In regards to our occupancy task force, we received in the last 24 hours 50 complaints that we responded to. We didn't have to refer any business to TABC, which is also positive. Again, I want to thank and express my gratitude to the business owners that are helping us achieve the intent of the governor's order. In regards to staffing, to go back a little bit, I want to take this time to dispel any misinformation and disinformation about the status of our fire stations. There are no fire stations that are closed. Every fire station is open. Now, we do have a strained staffing table. We have almost 200 firefighters that are in quarantine, and then plus all those, that are off on certain types of leave, on top of an already stressed staffing table, okay? So it is a tight staffing ability, but we are staffing every ambulance, we're staffing every fire truck. The ladders, we've had instances over the weekend since July 4th where we've had to idle certain units, but every fire station is covered by at least a fire truck, and most of them have an ambulance in the fire station. And all ambulances are in service, okay? I want to clarify that information because there is some disinformation out on social media. Our firefighters are doing an outstanding job of covering those extra shifts. Some of them are pulling double and triple duty, and we appreciate the work that they're doing. We're working to get the rest of these firefighters back and prevent them from getting exposed. But we can all do our part in the community as well to ensure that not only are we tampering down the spread of this virus, but we're limiting the exposure to our first responders as well. Thank you.
Thanks, Chief. I also want to remind people that the new testing site at HCC and Navigation is open today. And so we are adding to our testing capacity. The other two major sites, Butler and Del Mar, those stations testing sites are open, and certainly want to thank the governor for getting FEMA to extend their presence at those two testing sites through the end of July. So that collaboration with FEMA, the state, the city, that will continue through the end of July. Additional testing site at ACC and Navigation, so that is open. These are all free testing sites, and they are open and available for each and everyone, regardless of your status. If anyone asks you for your status or anything like that, that's violating the rules. So anyone in the city of Houston, they are welcome at all of these testing sites. And again, I simply want to encourage people to help us to reduce this number of people that are testing positive. And like today, 1,500, way too many. It is very difficult to do contact tracing when the numbers are that high. So we need to significantly work to lower that number such that our contact tracing program can be more effective. And the only ways we're going to be able to do that is that people have to really take these masks seriously, keep them on when you're in the presence of somebody else, the social distancing, the proper hygiene, avoiding these large parties, get-togethers, on weekends during the week. That simply is working against. And again, our initial purpose is to make sure that we don't overwhelm our healthcare delivery system such that if people need a bed, there will be a bed for them, and not just for COVID-19. But if they're suffering from strokes or diabetes or any other illness, we want to make sure that there's a bed for them. Some people may say, well, Mayor, I won't get COVID. Well, that may be true. You may not get COVID-19, but you may need medical assistance for some other ailment. And you want to make sure that there is a bed available for you, if not for COVID, for something else. So come on, let's work together, let's make it happen, and I just know that you will.